I now recognize the gentleman from Florida, Mr. Donalds.
Thank you, Chairman. I appreciate your sentiment. Before I get into questions, I think it's important to acknowledge what were just said. I want to start with some of the positives I just heard. The truth is that, yes, more competition in healthcare is going to be critical to deliver affordable care to consumers. And that's something I think which is a very bipartisan statement. I think both sides of the aisle can agree on that. I think one of the things that was also just acknowledged is that the entire purpose of the Affordable Care Act was not the Affordable Care Act. It was to take the United States towards single-payer health care. That was the design 15 years ago. So the American people need to understand the reason why costs are rising in health care and in health insurance is by design by congressional Democrats at the time and by then President Barack Obama. They did want a public option. They wanted to put a public option in the Affordable Care Act that was going to be lower cost than what their own regulatory framework would allow in the private markets. The only reason they didn't get the public option is because they didn't have the votes. A guy named Scott Brown won a Senate election in Massachusetts. I know that sounds crazy today, but he did, and it stopped them from actually pushing forward with the public option, which, by the way, its entire design was to move America towards single-payer healthcare. The arc of history in healthcare needs to be clear on this point. Single-payer healthcare does not work. It never will. Because to the point of my colleague from the other side of the aisle, single-payer is the very definition of vertical integration of the healthcare system, which will not lead to lower costs for the American people. But I digress. Mr. Jacobs, you referenced that a single Social Security number was linked to over 26,000 days of subsidized healthcare coverage across more than 125 insurance policies in 2023. What mechanisms can be put in place to detect and prevent this level of exploitation of taxpayer funds, and what underlying vulnerabilities contributed to this abuse?
Yes, Mr. Donalds, that's correct. And the Government Accountability Office report that was released last week was just one of many data points suggesting that there are significant amounts of improper enrollment and potential fraud on the exchanges. I think some of it is driven by, there are certainly rogue agents and brokers that have been acting, and CMS, both under the Biden administration and certainly under the Trump administration, have acted to crack down on that. I think eliminating zero premium plans, I think, is a matter of good policy that I think regardless, we should be asking everyone to pay at least a little bit of something towards their health insurance every year.
Jacob, not to cut you off, but I want to acknowledge something that you just said. In your opinion, do zero premium plans lead to fraud and abuse?
I think without a doubt, the system responds to incentives. And we've only had zero premium plans for the past few years under the enhanced subsidy regime. And we've seen that the concerns about improper enrollments, whether it's CBO or CMS with the data regarding zero claim enrollees in exchange coverage, all of them have been pointing to increased incidents of improper enrollments and fraud.
Okay, thank you for that. Mr. Obermeyer, if artificial intelligence becomes significantly integrated into medical practice, what impact should we expect on the healthcare workforce?
I think what we've learned from the history of automation and technology adoption is that it doesn't necessarily eliminate jobs. It actually changes the nature of those jobs. So doctors will start to need to interact with these tools and learn from them. And I think they'll start to augment the capabilities of especially nurses, community health workers, and others who can now have access to cutting-edge technology applied to the data from patients to help them make better decisions.
Real quick, and a quick follow-up to that. Do you think that the Affordable Care Act's regulatory framework allows for this type of internal innovation in the healthcare system?
I don't know about the ACA specifically. I think right now there are not very strong incentives for a lot of health systems to adopt this AI technology. I think the Access program that was recently announced from CMS is a good start in that direction by incentivizing preventive care augmented by technology. But I think that government programs can do more by, for example, creating payment codes for AI technology that drives lower costs, higher value care, and even detects the kinds of fraud, waste, and abuse that you mentioned earlier.
Well, look, I'm all for efficiency. One of the things I do have a concern about is I hear that, yes, AI is being used in some respects in healthcare, a lot of it for upcoding, as opposed to pushing for efficiencies. And I think it's a major issue that we definitely have to get our heads around, both here federally and at the state level. Chairman, if I might indulge, I did want to ask a quick question of Ms. Tripoli. I know I was hearing your dialogue with one of my colleagues earlier about affordability. I recognize everybody has a concern about it. Honest question, do you really think that a centralized healthcare system will lead to efficiencies and lower costs for the American people?
I think there are a lot of different models to get to a universal system of coverage that make sure that every person in the country has access to the affordable, high-quality health care and the health that they deserve. In any of those systems, you have to actually adjust the incentives and the way that prices in the healthcare system are set. And whether you're in the current system we have now or some future system, the reality is that the biggest drivers of our affordability crisis in this country on healthcare are the massive consolidation from corporate health systems, from insurance plans to drug companies to hospital chains. And so in any universal system of coverage, that issue has to be addressed. And of course, most immediately, if people can't afford care, then they can't access care. And before us right now, there's a decision about extending the enhanced premium tax credits, and we urge the Congress to act on that.
Well, look, Ms. Tripoli, we will have some agreement is on consolidation. I have serious concerns about that consolidation as well. I think if we're talking the a one-size-fits-all system, I mean, I've not seen one that's worked just about anywhere in any industry that's ever existed on this planet. But I know people will continue to try. Sorry, Chair, I know I'm over. I yield.
Thank you. I now recognize my colleague from